I think the multicenter retrospective study on the evaluation of the EV implant is really important because it clearly shows that the EV implant works for all patients, all indications, and all over the world. So basically, 7 centers from all over the world, both universities and private practices, were included in this study. We had a look at all patients consecutively treated from 2015 till 2016. And we just invited them for a recall. And we clearly saw very good and stable results over time. Very high survival rate, as expected, and nearly 100%, but also very stable bone levels and nearly no bone level changes over time. We also had a look at patient satisfaction, and we also saw a very high satisfaction, both when it comes to function, to aesthetics, for all of our patients. And the most important thing to me is it's not an RCT, it's retrospective. But anyway, due to the randomization, there was no selection bias. And it really shows how the implant behaves in different surgical hands, in different indications, and also in risk patients. There were patients included with a history of periodontitis, smoking, bruxism. So it's really a study that is showing the daily reality, and not like an RCT where we exclude all confounding factors to have a look at just one specific factor. No, it really represents the daily reality. We see positive patient outcomes every day when we use the EV implant. So for me personally, it's not about a case, it's about our patients. So we want a tool that is very reliable with very minimal complications. And that was clearly shown in our retrospective study as well. The implant behaves as it should. We see high survival, we see excellent bone stability. So it's not about a single case, it's just you want to be consistent, very consistent, and you want something very reliable to work every day in the practice. Science has always been important to me. That's one of the main reasons why I'm still working at university, being part of scientific community and contribute to better understandings of what we're doing every day. The Astra implant is one of the very well documented systems out there, and it's also the implant I used when my mom was losing a tooth. So it's really the implant that I want in my mouth as well. Yeah.